Hi everyone, I just wanted to take the time to thank you for tuning in and taking the time to listen to my little documentary. My name is Torin Tucker. I'm a second year film student, currently studying film and TV media productions at Braintree and Colchester Institute. This is my final piece for assessment and it is a subject that is very close and dear to my heart, so I've had a lot of passion and I've put a lot of work into this. This is going to be a documentary on a very rare neurological brain condition called cluster headaches that my mum sadly suffers from. I hope I can keep you all engaged and that you learn and enjoy something, so cheers. The suicide headache, also known as cluster headaches, is the worst pain currently known to medical science. It is an extremely rare neurological disease that is estimated to affect less than 0.2% of the population and was described by a leading neurologist as being the most severe pain experienced by mankind. The exact cause of cluster headaches is still unknown, and at this point in time there is still no cure for it. They can begin at any age, the youngest known member being just 10 years old. I believe the term headache is a little misleading, as many people instantly think of an ordinary headache or migraine. I can assure you that this is no ordinary headache. Women sufferers have even quoted that each attack is far worse than childbirth. Hopefully that kind of puts into context just how destructive this disease can be. While sufferers will experience a sharp, piercing or stabbing pain, the worst of the pain is usually concentrated towards the eye on the affected side of the face, often leading into the cheek, ear, jaw and upper teeth. The noticeable symptoms when a sufferer is having an attack is excessive tearing, swelling or redness of the eye, and a drooping of the eyelid. Profuse sweating, very red and rosy cheeks, often accompanied by a runny nostril or a nostril that is blocked on the affected side of the face. Although not all sufferers will experience all of these symptoms, they will most definitely have to go through the pain of attacks, practically at the same time each and every day, as most sufferers will be woken from their sleep to the immense pain due to CH being connected with the body clock. As well as being the worst pain known to man, cluster headaches also brings with it many other life-altering challenges that sufferers have to endure on a day-to-day basis. These can include PTSD, anxiety, depression and agoraphobia, and these are just to name a few. Agoraphobia is where a person becomes afraid to leave the house, and in a sufferer's case, this is coupled with the fear of having an attack outside or in public. Just a simple stroll like this could prove too much for a sufferer. Surprisingly, this disease is not lethal, in the sense that it can't outright kill you anyway. So sufferers are forced to endure the agonising pain daily, and in some cases even hourly. Sadly, there is no cure for cluster headaches at the moment. This is not helped by the lack of support and funding from the government. Knowledge within the medical profession is limited, with many cluster headache sufferers being misdiagnosed and sent away with the wrong medication. There are, however, charities that provide support, funding and research. The main charity being Ouch UK, organisation for the understanding of cluster headaches. They have a large community of followers and a good social media presence. This condition can leave patients unable to leave the bed, let alone having the energy to go to work and support their families. So the main reason I began creating the idea for this documentary was to raise awareness of such a devastating yet so unheard of disease, and to reassure any of the sufferers out there that you are not alone in this. There is still hope. There are ways of managing and containing the attacks, and I will be talking about some of the preventative methods and medications during this documentary. So, in order to show you just how little people actually know about cluster headaches, I took to the streets of Braintree in order to ask the general public just exactly what they thought they knew about the suicide headache. Hi there.
Hiya.
How are you doing today?
Good, thank you.
Oh, brilliant. I'm really good, thank you.
Good.
So, I just wanted to ask you, I'm doing a documentary on cluster headaches.
Okay.
I was wondering if you'd ever heard of them.
I've not heard of them, no.
Have you ever heard of cluster headaches?
No, I haven't.
No. No.
No, I haven't.
Never heard of cluster headache. Okay. Would you mind taking this leaflet
Yeah, no.
and having a little flick through of it?
Yep, I'll have a look.
So it has everything you need to know on cluster headaches, so
Yeah, no, that's
brilliant.
fine, I'll have a look.
Oh,
Yeah.
thank you very
That's
much.
all right.
Cheers. The other reason I decided on creating this documentary was because around 4 years ago, my mum was sadly diagnosed with chronic cluster headaches. She was misdiagnosed multiple times, as is the case with the majority of other sufferers too. She was misdiagnosed by her GP as having an inner ear infection. She was prescribed a course of antibiotics that done absolutely nothing for her or her symptoms. To show you the traumatic effect that cluster headaches can have on a person's life, I managed to get an interview with my mum on one of her well days, as she calls them. What happened when you had your first cluster attack? Did you know what was happening?
No, to be honest, I had no idea what was happening. I would say that we actually thought it might be a really, really bad ear infection. We really didn't know what it was, but the pain was so bad that we ended up thinking it was probably some form of tumour, cancer in my head, and it was something that I was going to die of because the pain was so bad. It took 8 weeks before we got diagnosed properly, before we got through 7 doctors.
Did you need to go to a specialist then?
Yeah, eventually, in the end, we went to see a neurologist who we've had found out specialised in cluster headaches.
Do you feel that your doctor has been supportive and fully understands the disease and what you're going through?
My doctor, luckily, unlike many people who suffer CH, they don't have as much luck as I think I have. My doctor is very, very supportive. He's found out as much as he possibly can about CH. He's made sure that all the other doctors in the practice can spot the symptoms of cluster headaches as well. He hasn't been brilliant with the medication that I need. That's really been routed through the neurologist.
Describe in your own words what a cluster attack feels like.
Okay, so in my own words, one of the ways that I got diagnosed was using photographs to show the neurologist, because you don't often see a cluster headache having an attack, because they tend to be in the early hours of the morning, or people tend to hide themselves away from family and friends. It feels like there is a massive screwdriver literally being shoved right down my ear hole, that I have maybe like hooks or ice picks or sometimes like tattoo needles in my eyes, in one side of my head only. I feel like I've had scalding hot water poured over my head, and that attack can last from anything from 15 minutes to 3 hours. My longest was 4 hours, where I ended up in A&E. It is indescribable, worse than giving birth, which I have done. They say worse than having an operation without anaesthetic.
So what do you feel like after an attack?
After an attack, I feel absolutely exhausted. I often don't even go downstairs. I mean, I've probably spent 3 weeks just recently upstairs in my bedroom, unable to cook or to do general normal things in life, because I am absolutely exhausted from being so ill all the time. We also suffer something which we call shadow headaches, and it's part of having cluster headaches, where it kind of feels like you've got a small screwdriver stuck into the corner of your eye or something, and it just hangs around there all day. And just normal everyday life is difficult to cope with and to deal with. Also, my memory loss is a big part of CH, and I really have lost lots of my memory as well. So it affects my whole life in a bad way, really.
Cluster headaches come in 2 forms, chronic and episodic. An episodic cycle can be very different for each individual, varying and depending on the person. This is where you may have a period of many weeks or months of between 1 and 6 attacks every day, each lasting anything from 45 minutes to 3 hours. The condition will then go into remission, and you can have months or even years pain-free. A chronic sufferer, sadly, does not get to experience this remission period, dealing with these excruciatingly painful daily attacks month after month, year after year. 25 years or more is not uncommon. Most people who suffer with CH will at the very least contemplate suicide, from the side effects to the extreme lack of sleep that comes with it. For a long time, it felt like we were stuck in a hole. We had reached a dead end and had nowhere left to turn to. And this is how we thought it was going to stay for the foreseeable future. We soon found that we were not alone in feeling like this. A large social media community had developed over the years, helping sufferers share stories and information to anyone willing to listen. Luckily, through the Ouch social media page, my mum was introduced to an osteopath whose daughter is also, unfortunately, a cluster headache sufferer. This person is very well educated on the condition, sinking many hours into raising awareness and helping fellow sufferers, whilst also being very knowledgeable about the many different types of treatments available. They were able to recommend us to the country's leading neurologist who specialises in cluster headaches and is based at London St Thomas's Hospital in the pain management clinic. My mum was referred there by her local GP. The medications and treatments are a bit of a minefield, as it is very much down to the individual as to how well they will respond, if at all. There are two types of medications, abortive and preventative. The two main weapons in a cluster sufferer's arsenal are high-flow medical oxygen and sumatriptan injections or tablets to be taken during the onset of an attack. These are known as abortive medicines. Sumatriptan, although effective at dealing with the pain, comes with possible negative side effects as it can leave the patient incapacitated and can put strain on the heart. Preventative medicines, on the other hand, are taken long-term to suppress the severity and number of attacks each day. These, however, can also come with many unwanted side effects and have varying levels of success. During my mum's visit to the neurologist, she was administered an occipital nerve block injection, which is another type of preventative medicine. It consists of a combination of steroids and long-lasting anaesthetic. It is an unpleasant procedure, but has improved her life greatly. Although by no means a cure, she has been well enough to focus more on her work, but most importantly, she's been able to socialise more, something not thought possible just a few weeks before. Another new procedure available to cluster sufferers is the SPG nerve stimulation implant. Studies have shown encouraging results, and my mum is on the waiting list for the procedure and will explain in her own words shortly. This is my second interview with Claire Tucker, my mum. You've now had 2 lots of nerve blocks. Can you tell me a little bit about them?
Yeah, that's right. So the first lot of nerve blocks I had, it took about a week and a half before it worked, and it only really lasted for about 2 weeks of pain-free time. But during that time, I was able to pick up on some of my life hobbies. For an example, I did an exhibition with my art, and I also incorporated that with an awareness day for CH. So I had a cluster awareness day, which was great. But unfortunately, after 2 weeks, the nerve blocks started to not work. So we went back to St Thomas's in London, but this time I had 2 above my eyes, one here and one here, and then one in the occipital nerve block, again in the back of my head. This time I wasn't allowed to have steroids again because it was too close together, so I had just long-lasting anaesthetic. Had that done on the 8th of April, and it's now the 22nd of May. It's really working well. I do get some days where I'm not as good, but really it's much better than what I was.
Did you give you any pain relief for that? Or?
No, it just I just let the pain wear off. It's painful for it was 1.5 weeks the first time, and only about 3 or 4 days the second time. But again, it's just like sore in that area that the injection's gone in. But again, it's better than the pain of cluster headaches. It just doesn't compare, so it's fine.
Are there any negative side effects from it, or?
No, there are no side effects to it. The only side effects possible is an infection in the injection site, and some people can get like an itchy scalp or an itchy area where the injection was. But other than that, there are no side effects, and you are leading, an almost pain-free life after the injections.
So the nerve blocks have worked well for you then?
The nerve blocks are brilliant.
And with the long-lasting anaesthetic, you can have as many as you like. The ones that are mixed with steroids, you can only have every 3 months.
Oh, okay. So does everyone with CH get them?
No, so most people with cluster headaches are episodic, which means they get them at the same time of year, every year. So they usually use the more mainstream drugs, which are verapamil and topiramate, to suppress the attacks. But with chronic cluster headaches, they give nerve blocks if, again, we're not responding to the mainstream meds, which a lot of cluster people don't. So it's then that they will give us nerve blocks. And from the nerve blocks, if they don't work, which sometimes they don't, same old story for cluster headaches, one thing works for one person, but it doesn't work for another. So there are other procedures, more invasive, that are available to chronic cluster patients, and I'm on the list for an SPG operation myself, which is basically an operation that goes into my face to the back of my nose to a ganglion of nerves, where they pulsate them using radio frequency. But as I said, that is more invasive, and that might come on if my nerve blocks stop working.
So is that where you're looking to go next?
Yeah, it is. Although at the moment I am trying out another medication called gabapentin, and that seems to be suppressing the attacks along with the nerve blocks. I'm hardly getting any attacks at the moment, actually, so I'm doing really well. So I might not go for that next operation unless it stops working.
The following footage was taken a week after my mum's nerve blockers. This is the art exhibition that she had previously mentioned in her interview. The footage shows just how wondrous that these nerve blocks can be and the effect that it can have on a sufferer. As you can see, they've had a profound effect on her well-being. Thank you all so much for watching, and I hope that you learned something new about cluster headaches. But more importantly, I hope that you can now recognise the symptoms of cluster headaches, so less people will suffer in silence. Thank you. I also wanted to do a big shout out to all of the people that helped out throughout the production of this documentary. Without your help and videos, none of this could have been possible, so thank you very much.